Right, well, the Competition Commission says with effect from today, consumers will not pay more than 500 Rand for COVID-19 PCR tests. The figure includes VAT. The Commission's statement comes after it reached an agreement with two major laboratories, Ampath and Lancet. Competition Commissioner Thembinkosi Bonakele has urged other laboratories to also lower their prices of tests in line with the agreement. Bonakele says consumers must report laboratories that are still charging consumers more than 500 Rand for the tests. He says their investigation revealed that the laboratories had realized a significant decline in the cost of conducting the tests, but the prices for the consumers had remained higher. Let's take this discussion further then. We're joined via Zoom by the Competition Commission's Chief Economist, James Hodge. James, thanks so very much for joining us here on SABC News. A very good afternoon to you, sir.
Good afternoon.
I understand that the agreement comes after talks between the competition and the two major private labs, being Ampath and Lancet. Let's talk about the complaints regarding their prices. I mean, the Council for Medical Schemes had tabled a formal complaint to you. Why did it take a complaint from them for you to see that the prices were indeed exorbitant? I mean, this has been ongoing for some time. Why was this not red flagged before such a complaint?
Well, no one had red flagged it for us prior to the complaint, but once the complaint was lodged 2 months ago, we moved with extreme speed. And to conclude an investigation and settle it with agreements within 2 months is kind of unheard of. So we have treated it seriously. I think in undertaking this process, we are being alerted to other problems in the healthcare system that we may need to address with more urgency as well. And so we will look at that from now on.
Yeah, I mean, then it still begs the question of whether, 500 Rand is even justifiable. I mean, what's the actual cost, if one may ask, to conduct such a test to the lab itself? And maybe we should ask a more holistic question. What's the average price of those tests globally? What's the actual standard?
So in terms of the costs, as part of our investigative powers, we can and did call for the costing and the financial information for these laboratories. And we did query it, we've interrogated it, and we're comfortable that 500 Rand, including VAT, covers the costs and doesn't give them undue profit. I think in comparing globally, there's a lot that differs between countries, and we see tests in Europe often are considerably higher than South Africa in the past. And this is partly because of the labor costs, the other costs that go into the collection, which are all more expensive in those countries. So ideally, we need to be looking at our own costing. And what we've done in the consent agreements is also require that the laboratories provide us with cost information and pricing every 3 months so we can see if costs have come down and whether further reductions are necessitated.
You've called on other labs to follow suit and also charge, that around that price of 500 Rand. I mean, if one should find that there's another private lab that's charging more than that, do they have to go through the process that the Council of Medical Schemes went through of having to report to you and then another additional 2 months, as you say, to go through the complaint, or how will you make that less burdensome and quicker to resolve should someone actually complain about another private lab whose price is higher than the 500 Rand?
Yeah, so the complaint was made against Lancet, Ampath and Pathcare.
Yeah. And
we are trying to conclude settlement discussions with Pathcare. I think these agreements will accelerate that process, and we'll obviously report when we can. But in terms of the public, we do have a WhatsApp hotline number. So it's 084 743 0000. And the members of the public can use that to alert us, and we can move with haste. Now we know what the true cost should be for one of these tests. It shouldn't take as long to conclude any investigation on other laboratories.
Yeah. Can I just ask you to repeat that number again? I'd like to repeat it for our viewers.
Sure, it's 084 743 0000.
Okay, all right. Thanks very much. And let's talk about, after you've decided that these labs and we've seen some of the work of the Competition Commission in the past, where sometimes it happens that you will place a penalty on companies, let's say, whose prices were too high. In this case, is there some sort of a punishment imposed on Ampath and Lancet? I mean, after you've said, no, guys, you're dropping your price to 500 Rand, what's next? That's it. I mean, the fact that you obviously established that the price was exorbitant and that they unnecessarily got undue amount of money or profit from people in South Africa. What's next? Is there no sort of punishment based on your findings?
So there are no fines in this case, and that's almost a product of an accelerated settlement process.
Yeah.
So the alternative is we can litigate this, but we could be tied up in litigation for the next year. We may not get to that particular price point in litigation. So there's many uncertainties, and that's why parties look to come together and settle these. We think it's in the best interest of consumers that we get it down as low as possible as we're going into this fourth wave, where testing will accelerate on a daily basis, and for future waves as well. And also we've seen that now increasingly for things like travel and even returns to office, PCR testing is becoming a requirement. So the level of testing that even happens outside of a wave is quite large nowadays. So we want to ensure that the savings are available immediately, and we don't delay that for the sake of just imposing a penalty, which is be the only benefit.
So the reason I asked about the penalty is because I'm thinking that, something like this might have really impacted, the high prices of these PCR tests might have really impacted on the country's efforts to fight COVID-19. I mean, if someone doesn't have that 650 Rand or whatever the price that they're given, then you're probably going to say, oh, you know what, I just don't have the money, I'm just not going to go. And maybe someone doesn't even want to go to a government institution. I mean, that on its own would be, killing our efforts in terms of fighting COVID-19. And surely that should mean that there should be, in fact, some kind of a penalty. I'm just arguing this issue of you not imposing any kind of penalty and deciding not to go with litigation, which it seems quite important given what we're going through in this pandemic.
Yeah, and it's right for you to raise that. It's right for the public to raise that. I think the trade-offs are apparent. I mean, exactly what you have indicated. Bringing down the price actually enables the fight against the pandemic. Yeah. And we need that tool now. We don't need it in 7-8 months' time when we might be successful and get a penalty. So that's why these decisions are made. And they can be criticized, and people may have opposing views. But we think, at least in our judgment, it's important to bring down the costs so that more testing can be done, and we find ways to sort of contain this pandemic and get back to normal. So if, for instance, bringing down the price means that our travel industry can open up and get more visitors, that's a big economic boost. But it has to happen now. It can't happen in a year's time. We have suggested also that there needs to be other strategies that the state looks at in terms of, for instance, improving the role of the antigen test, which is much cheaper and which could be used maybe not for international travel, but for other purposes. So I think there's ways that we've also got to think collectively about the cost of testing and managing the pandemic, including also looking at the suppliers for these products and seeing if we can't get cheaper prices as well. So there's a lot going on that I think needs to come to fruition now in order to manage the pandemic. But we see this as a key point.
All right, James, thanks very much for giving us your time. Much appreciated. James Hodge is the Competition Commission's chief economist. We appreciate your time.